Yes.
Well, that's why you
Stop
need a
it.
guy like Joe Moscato, who is the president and CEO of a biotech company called Generex Biotechnology Corporation. Generex Immuno-Oncology Incorporated, GNBT is their stock symbol. And you can also go to newgenerex.com or just generex.com. And we finally, because this is the busiest guy in the world, because he is going to have a vaccine that transforms everyone, at least as far as I'm concerned. Moscato, Joe, how are you, sir?
Moscato.
How are you guys? Great to be back.
Good to talk to you. Give us an update, because you've been busy and there's been a lot of great things happening with the company.
So we finished all of our testing, our ex vivo human trials, and we completed our GMP manufacturing, and we put our FDA response package in on Friday. So we have 30 days now to wait. We did everything they requested. We did all the GMP engineering reports included. All the testing, which is superior, and we proved that we have a complete vaccine, unlike probably everyone else, where we're completely safe. We give all the antibodies up front, and more importantly, we give long-term memory on the back end, which means you won't have to keep getting vaccine over and over and over again.
So let's talk. So what's the main difference between, again, with the news coming out about J&J having their vaccine retracted from many states? I know California just did as well, and there's problem. And of course, we're hearing about the two-shot Moderna and Pfizer, where the second shot's a little bit rough on folks. What's the big difference with the Generex deal?
There's a bunch of big differences. So we are room temperature, so we're easy to deliver and transport. Also, we only skew TH1, not TH2, because we don't use the full spike protein.
What does that matter to the rest of us? Why is that a good thing? Just so because
because the full spike protein throws off 1,791 non-neutralizing antibodies. So the very word non-neutralizing means that they're free radical, so to speak, and the body eventually attacks those free radicals, those 1,791 bad guys. That's why people are getting off targets.
I see. Okay. Yeah. And with respect to this, now, when you guys make a vaccine, because when I hear about vaccines for, let's say, the flu vaccine every year, there's a million different strains of flu, and you're just lucky if you get the right one.
Yeah.
Is this have a bigger spectrum, or is this criteria specific just for COVID-19?
Well, we're breast cancer. We've shown 10-year data where we're still protecting all of our patients from breast cancer. We're still protecting the men in our prostate cancer. It's the same technology we use for those applicational areas that we're using right now for COVID. So again, we only use the best parts of the spike protein and the parts that don't change or mutate. So the chances of our vaccine not working for all of the strains, the variants, is very, very, very low.
And here's, I guess, my next question is, and you mentioned this at the very beginning of the broadcast, talk about approvals, talk about FDA, talk about where you guys are in the arc of that story.
So we put our package in on Friday. It's a response package on all the things they asked us for. So we completed everything they asked for. Proving out all those areas are quite good. And we're waiting for their response, which hopefully will be in 30 days. And then we'll put our IND in. And that IND will allow us to go into phase 1, 2, and 3, which will be very quick, because we don't have to do the tens upon tens of thousands of people like the gene therapies had to do. They had to do 30, 40, 50, 60,000 patients.
Sure.
We don't need to do that at all.
And with respect to sort of where you think we're going to be here, what do we have as far as vaccination rates go right now? 30% of the country being vaccinated. Are you coming in just about the right time, aren't you? Especially with J&J having a hitch in the giddy up.
Well, it doesn't matter to us if the whole world gets vaccinated. All the big drug companies today have been saying they're moving to a 3-shot booster, and then they're saying that at the end of 9 months, they're afraid that everybody's going to need a new vaccine again.
Oh boy!
So it'll be a yearly thing. We come in, we'll give you the long-term memory. Hopefully on the second round, and vaccinate the world. I mean, so as of right now, and then we even are a universal booster for the long-term memory for those vaccines.
Oh, so that means that I could get a second shot from you, even though I got a first shot, let's say, from Pfizer or Moderna.
100%. Yes,
Wow,
that is
that's
correct.
good.
That's a big deal. When you say quick in timing, with the FDA, I never know what that means. Does that mean quick like within the year or quick within 3 years? What do you, if you were guessing, man, what would you say?
Well, if all the cards went our direction, and again, science constantly evolves, so you constantly have to stop, pivot, reanalyze, and then figure things out. So if we don't have to do that, and we can get right into the clinic, and we have all of the necessary assets in place, which we do, to get these trials done, our hope would be by November, December, we're complete, and we go through our phase 1, 2, and 3, where we get that approval, and we're, vaccinating people.
So here's my question before I let you out of here today. By the way, his name is Joe Moscato, President and CEO of Generex Biotechnology Corp. And new Generex Immuno-Oncology. Let's not leave the oncology piece of this on the table, because you guys haven't stopped what you're doing in other areas of research. Are you guys going to pick up the ball back on that, or where are you at? In the ophthalmology, the podiatry, the neurology, you have a lot of things going. What are you concentrating on next?
Well, I mean, we are doing clinical trials right now with Merck and their Keytruda product with our breast cancer vaccine. We're continuing that. That's ongoing. We're going to start 2 or 3 other applicational areas this year, as well as, Arizona. Our build-out will be complete May 1. So those services you just mentioned, ophthalmology, podiatry, pharmacy, they will all be in place. And then we're also starting our remote patient monitoring, which will start with those clinics that we're partnered with. So pretty excited about that. The build-out's taken a while because of COVID, but it should be complete by May 1.
Well, it's Joe. Let's keep you in the loop here. I want to have you on the air as much as we can here, because obviously that's a huge game changer. Name of the company is Generex Biotechnology. GNBT is their stock symbol. His name, Joe Moscato, President and CEO of Generex. So boy, could you imagine having a universal second shot?
That doesn't need to be kept at sub-zero. It's not like you can just put this in an ice pack and take it home.
Well, think about military applications. Think about mobile hospital applications. Think about all that stuff where you don't, And then, of course, if they're saying we got to go back in 9 months to do this all over again, the more the merrier. At least the ones that work, right?